Okay, welcome everybody. Welcome to the My HCP Standards 6. We're going to look at managing risk today and what that means for you as registrants, but want to welcome to our 6th My HCPC Standards session. They are all available on our website, so if you want to go to our website and look at the other ones, you're most welcome. You can see them, they're all recorded there for you to have a look at. So what are we going to cover today? We're going to look at a little bit about the role and standards, but again, I'm not going to cover it in great depth because you can look back at our previous webinars to look at that. We're going to focus specifically on Standard 6, which is about reducing the risk of harm and managing your own health. So really important things, really important today, particularly at the moment with what's going on at the moment with the pandemic. I think these things are really important. Just a bit of housekeeping. I've got some colleagues who I'll introduce in a second. Our webinar will finish at about 10 to 2, so we like to finish about 50 minutes on. That's really important, and we have asked you, if you've done before, to use our polling app, which is great, so I hope that you can actually use that, which always gives us really good information. And we've posted lots and lots of links in our chat. We would encourage you to use our chat, and my colleagues are here monitoring the chat for any questions and queries, and we'll definitely be answering those as we go. So no need to take notes, it will all come out to you as a lovely email after the event. Thanks to my colleague Holly. So you recognise me before, but I'm going to plug Hello, My Name Is, a fantastic concept from undertaken by Dr. Kate Granger. We'll put a link up again in the chat. But my name's Kim Tollier. I'm a professional liaison consultant and nurse by profession with the HCPC. I've got a couple of my colleagues on the line. I'm going to ask them if they wouldn't mind introducing themselves to you. So firstly, I've got Grace. Grace is from our Standards and Policy team. So Grace, would you mind introducing yourself?
Yeah, hi everybody, my name is Grace. I'm the Senior Policy Officer in the Policy and Standards team at HCPC.
Thank you, Grace. And we'll be talking to you later, won't we, Grace, about sort of some of the scenarios we're going to throw out there, which are ones from your policy team that I know you get. And Holly, you'll be sending out lots of emails, I know, and an evaluation after the event. So do you want to just say hello as well?
Yes, thank you, Kim. My name's Holly Butler. I'm the Events and Communications Officer at the HCPC. So I have to organise all the events and send you lots of emails if you signed up to one of them, and help with communications as well.
Thanks, Holly. And Holly pulls together your certificate at the end of the session, don't you, Holly, and sends out the survey link. So thank you for that, Holly. And we've got Kelly, who's actually my boss, but she's a really good looker at the chat room, and she will talk to us later. So Kelly, would you mind introducing yourself?
Of course. Good afternoon, everyone. My name is Kelly Green. I am the Professionalism and Upstream Regulation Lead at the HCPC, and as Kim has mentioned, I work very closely with Kim to help deliver some of these events and things for you. So welcome, everyone.
Brilliant. Thank you, Kelly. Thank you, Holly, and thank you, Grace. So a little bit about GDPR. We've put this up before, but just to recognise that your chat, when you write in your chat, it will be, your name will show. So just so you're aware of that. Some people are actually writing in the chat in the Slido app already, but we prefer, if you don't mind, just keeping it in the chat beside the webinar. It just is really helpful for us to have it in one place. Then Kelly and Holly and Grace haven't got to look in two places. So that brings me nicely to the Slido polling. The event code for today is My HCPC Standard 6, and I'm going to go to the usual question, which I know I keep asking it, but actually I can't tell you the useful information this is for us, because it allows us to see who's on the call and who isn't. So if you just wouldn't mind saying, what professional group do you belong to? It's just, again, really helpful because we can see who we can publicise this to. We can obviously work with your Royal Colleges to publicise it through them, and I can see that we've got quite a lot of paramedics on the call, some physiotherapists, today some practitioner psychologists, which is absolutely fantastic. I'm really pleased. Some speakers, as I would call them, SALT, speech and language therapy therapists. I'm sorry to abbreviate your role, so I apologise for that. Okay, fantastic. That gives me a real good idea who's in the room today. Wouldn't it be nice if we were in the room today? And my second question is, when you think of the HCPC, what are the words that come to mind? You might think this is a bit of a weird question, but it's super, super important for us. Biomedical scientists, thank you for writing that. It's wonderful. Biomedical scientists here today, brilliant. You might think that's a really painful question, but actually it's super important for us to see what's useful to you and what isn't about what we do. And you're right, we are a regulator, I can see that, and we do professional regulation and we do guidance, and we do, you're right, charge fees for the role that we do. We're an independent regulator. So thank you for that. I'm not going to dwell greatly on that, but that's super important. We pulled together all the evaluation comments from all the standards webinars that we do, and it gives us a real good feel about what the issues are for you and how we can help you. So thank you for that. That's honestly really helpful. So tiny bit about our role. So as you know, we write standards, we do quality assurance of education. We write some fantastic standards of proficiency for each of these standards that each of the professions we regulate, the 15 professions we regulate. But today we're really going to focus on the red one, which is the standards of conduct, performance and ethics. And that's what sort of underpins everything that you actually do. And we're going to focus on standard 6 today, and that's very much focused on risk. And risk is very current at the moment in the current pandemic, and looking at risk. So just another quick question, which will take 2 seconds as well. How would you rate your current understanding? And I've just noticed a typo. Isn't that terrible when you just notice a typo? Current understanding of standard 5, it actually should read standard 6 of the HCP standards, conduct, performance and ethics. So if you want to just write that, that's really helpful. So we've got some middle ground. We've got some people in 5 and 6. It's just a press of a button. It gives us an idea. We can see whether you've improved or not improved by the end of it. It just gives us a little bit of a framework. So thank you very much for that. Brilliant. Okay, so let's move on to the next slide, if that's all right. So standard 6 has actually got 2 components. As I said to you, it's all focused really on identifying and minimising risk, but also managing your own health, because that's really important as well. And we're going to take 2 parts to this webinar. First, we're going to look at minimising risk, and then we're going to look at managing your own health. So first of all, managing risk. This is actually what we say in the 2 parts of our managing risk standard. You must take all reasonable steps to reduce the risk of harm to service users, carers and colleagues as far as possible, and you mustn't do anything or allow somebody else to do anything which could put the health and safety of a service user, colleague or carer at unacceptable risk. And that never before has this been heightened so much, really. Wanted to signpost you to some parts of our COVID hub, and I think the most important part of our COVID hub that we're seeing lots of footfall through is our managing risk, infection control and prevention part. And this covers some really important questions that you might be concerned about during the pandemic. You know, what should you do if you feel you've got insufficient PPE? We are still occasionally hearing this. We heard that a lot at the beginning. Can you refuse to care for a patient if there's insufficient PPE? And all about treating service users, you know, in their own home. And we obviously link also to the government guidelines. And I also wanted to just flag to you while we're on this screen that, you know, we've recently published a joint statement from many regulators, and I know that lots of people are very worried in the current pandemic, particularly about getting complaints. I think as a registrar myself, I totally get it. We all worry, and we want to obviously thank you all for what you're doing and the care you're providing for patients in these really difficult and challenging times. Lots of you are involved in care of patients, but some of you are involved in vaccinating patients, which is wonderful as well. But we know that professionals are going to be really anxious about, you know, if you get a concern raised about you, will we take into account the context of the situation that you're working in? And we wanted to reassure you, and I know that Holly will put the link to this joint statement that you can actually read in full for yourself on our chat bar. But we wanted to reassure you that context will be taken into account when concerns are raised about decisions and actions that you take in these really challenging situations. And where we do get concerns, and I have spoken to my fitness to practice colleagues about this, that they'll always be considered on the specific facts of the case, but we will take into account factors related to the environment in which you're working, because we all appreciate some of you will have been redeployed, some of you would be working under very unusual situations and circumstances. So we will also take into account any information about resources, guidance and protocols that are in place at the moment. So that's, I think, quite a reassuring piece of a statement that's actually just come out from us, which I think is a really good one. So it's worth having a little read, but some really good stuff on our website. So we wanted to start our conversation with you today because Grace obviously monitors the inbox for the policy team, and we're hearing quite a lot of concerns from our colleagues about issues about getting the COVID-19 vaccine. Now, it's obviously being rolled out, as we all know, and we're all seeing the photos on the television about health and social care staff having it as a first priority, and then the over 80s, although it's coming down to the 70-year-olds now. But we're getting some concerns from our registrants about this. And can I introduce you to Peter? He's a private practice physio. There were some physios on the call today. He's 40, so he's not in that over 70 category that we're in at the moment. And he wants to get the COVID vaccine as he works in health and social care. Obviously he does. And how can he make sure that he gets the vaccine as soon as possible? So that's some of the concerns that we're getting from our registrants. And I'm going to pass you over to Grace, if that's all right, Grace, because I know that Grace has been quite involved with the COVID vaccine delivery plan and some of the concerns that are coming out about that. So Grace, I'm going to put you on the screen, Grace, if that's all right. Have you got anything you want to say about that, Grace?
Yeah, thanks, Kim. So as you said, we've had a number of queries from registrants around vaccinations, whether it's to do with administering them, but specifically we've had a lot of concerns from those working outside the NHS about whether they're eligible to receive the vaccine as part of the priority groups outlined by government's delivery plan, and concerns about how they're going to be identified and contacted. So I'll just start by reassuring anybody who is in this situation. JCVI, the Joint Commission on Vaccines and Immunisations, as well as Public Health England, have issued guidance specifying that all those involved with direct patient care will be eligible for the vaccine as part of the second priority group. They've put out delivery plans on the vaccinations. For those working in NHS settings in secondary or primary care, I'd really advise you to speak with your manager or your employer about accessing the vaccine, as they will be responsible for delivering it to you. For those that are working outside of the NHS, just to reassure you that we're currently working with UK governments to try and establish what the plans are to get the vaccination to you. My advice would be to continue to look at our vaccination pages, because we'll be continually reviewing and updating those as the context evolves. So reassuring you that we are working on it, and look out on all of our social media, etc. And hopefully we'll have an answer for you very soon.
Thank you ever so much, Grace. That's really reassuring to know that the HCPC is using its sort of lobbying power and influencing power to try and get this sorted. So it's about following us, really, isn't it, on our Facebook, our LinkedIn accounts, really, because that's where we would put up if we had any information, isn't it, really?
Yeah, exactly. Yeah, we've got vaccination pages as well as our social media, Twitter, LinkedIn, etc.
Yeah, thank you ever so much, Grace. That's actually really reassuring. So thank you very much for that. That's absolutely fantastic. And again, we will take questions in the chat if anybody wants to pop anything in there. And I'm going to come to Kelly in a minute and ask, but we'll just focus on you know, that's really important, and just a bit of reassurance, really, that we are working very hard to try and get that sorted out for you. Okay, so going back to this risk that the risky situations we're all under at the moment, and I just wanted to give a bit of context, because I make no apology for just referencing a couple of really important defining reports that I just want to mention to you that I think are exceptionally good to have a quick read of. The first one is the Mid Staffordshire report, which came out in 2013, what they call the Francis report, and just wanted to remind everybody about some of the findings that are really disturbing in there. And as a nurse, I found some of the findings really disturbing to read. And obviously it frames what we do in health today about risk. And that arose, from that arose the executive summary and of the Freedom to Speak Up report. So Robert Francis actually wrote the Freedom to Speak Up report, because it set out principles and actions to create the right conditions for staff to speak up, because we know how difficult it is to speak out. And I think we have seen examples of where staff have spoken out, particularly in the beginning of the pandemic, related to things like lack of PPE. Staff felt able to speak out in that situation. And on our website, there's some really good information about how to speak out. And we have obviously in our standards of conduct, performance and ethics, a specific part that looks at the importance of all of us of speaking out if we've got a concern. So yeah, it is important. And Grace already pointed out the importance of your manager in this situation. So speaking out to your manager and having a look on our website if there's any other information. And I wanted to flag again, I have talked about this before, but again to remind everybody about the Freedom to Speak Up Guardian. Every NHS trust and a lot of private organisations have a Freedom to Speak Up Guardian. So have you found out who yours is? Because they would really help you if you're worried about something. The Freedom to Speak Up report that I talked about, the 2015 report, recommended having a Freedom to Speak Up guardian in every organisation. So there are 600 across the country, and nearly 30% of them are actually outside NHS trusts. So whilst we often think that all these things are in NHS trusts, but actually they're not. So, you know, hospices have them, other organisations, CCGs have them, some private and some voluntary sector organisations have them. So they would be that individual would be an independent person who you could go and see if you had concerns about how to speak up about any of these situations that we're actually talking about. So since we've talked about some really, and that's a list of the Freedom to Speak Up guardians, which we will put out on our chat bar. We've talked about some really contentious, difficult issues already, and I wanted just to nip over to Kelly and see whether Kelly's got any questions, because it's really hard for me to monitor chat as I'm speaking. So Kelly is my eyes and ears to monitor chat. So Kelly, is there anything coming up that we can answer on screen, Grace or I?
So I can do my best. First of all, I just want to apologise. I think some people had a little bit of difficulty with the polling earlier. We do have some more questions coming during the webinar, and we'll try and make sure that they do remain on the screen long enough for people to get their answers and responses in. So we have a question from Paul that came in through the Slido chat box, asking what is the importance of stress risk assessments. I think probably what we're talking about here is the HSE, so the Health and Safety Executive sort of stress risk assessments that some employers will have some responsibilities for doing. Grace, I don't know if that's something you have enough knowledge on to answer, but if not, I can probably help with a little bit of a response. Grace, so I don't know if that's something that you can answer.
Sorry, Kelly, I was just responding to one of the queries in the chat there. Would you mind taking that one if you're all right?
Sure, absolutely. So I think my understanding is that employers of certain sizes would be required to carry out some risk assessments of the stress on their staff. Yeah. And I think I'm not entirely sure, I would need to check, but I think there may be some legal requirements around that too from the Health and Safety Executive. So I think they are important. The fact that they have that status demonstrates to us how important that they are. We would encourage employers to be undertaking those in normal circumstances, and also, you know, the pandemic will have no doubt changed what may have been risk assessment outcomes that they had previously to current, just because of the conditions that people are having to work in at the moment. So I think really in answer to the question of what is the importance of them, I think we would say that they are very important.
We would say they're very, very important, and don't forget that there's people like your occupational health departments in big organisations where you can speak to about your COVID risk assessments as well. So yeah, really, really important. Every member of staff should have a risk assessment done.
Yeah. I think it's really only very small organisations that aren't obliged to undertake them, but I think also are encouraged to undertake them, even if you're a small organisation. So we do think they're very important. Another question that we had come in was really asking about the testing of patients, and my understanding, really, the way the question's been posed is whether we think it's necessary for every patient to undergo a COVID test or an antigen test, and I'm assuming that's before they're seen. For me, I think that logistically could be a real challenge. So I think that would present an awful lot of difficulties, perhaps doing that. But I don't know, Grace or Kim, if you've got any thoughts on that.
I mean, a lot of people are COVID tested prior to elective surgery, for example. That would be a very routine thing that's now happening all the time. And as you know, a lot of the staff are having lateral flow testing twice a week, often before they go on shift. But that's really an employer issue, employer. That's why I'm getting confused. Employer issue to do a risk assessment on patients and work out whether they need a COVID test. Yeah. Is that all, Kelly? Is there anything else?
I think that's mostly what we have at the moment. So I'll come back again a bit later with any more.
That's
you.
Lovely. And actually, that's my fault for closing the poll so quickly, so I do apologise, but we'll sort that a bit longer next time. So the second part of standard 6 is managing your health. Now, this is really, again, I couldn't fundamentally talk about never more important than at the moment, really. And we do get quite a few concerns about managing your health. But the first thing I wanted to flag up was that we have some really good wellbeing support and wellbeing resources, and Kelly actually wrote this, and it has been updated since last year. We keep adding to it every time we find some wellbeing information. But we wanted to do a quick shout out to you, really, because I find generally that there's nothing better than asking individuals and asking each of us what top tips we have to share about wellbeing. And so I'm going to ask you in the chat box to just write down, if possible, your top tip that you can share with your colleagues to support each other as we go through this really difficult time. My top tip, and I'm going to share it, is the fact that I was quite reluctant to access support, but actually I did access psychological support for the difficult time that I was going through initially in the first wave, and I accessed the support that was available through the big trust that I was working through the wellbeing support. And I actually spoke to a psychologist who was actually a pain psychologist. Very interestingly, she'd been re-diverted to the pandemic response and supporting staff, and I found that just an hour with her gave me a really good insight into why I was feeling as I was feeling, and we also devise some strategies to enable me to cope with the situation. So for me, accessing and making that first step of accessing support was really, really helpful. So if you want to just write anything just to throw out there. I don't know, Kelly, have you got any top tip that you'd like to share?
Yeah, you know, what I did the other day was actually just have a FaceTime call with my best friend.
Oh.
And I'm going to be honest, we've both been talking about doing it since Christmas and hadn't quite found the time, and then we made sure we found time. And I enjoyed it. I enjoyed it for lots of reasons. One, because it was just great to see my good friend. Two, we laughed about a few things, which was really nice in the current climate. But also, you know, for me, often our friends tend to be people who are in the same situation that we're in, you know, live like we do have the same interests and things. And so we're both facing the same challenges. And I think it was just really nice to know that actually some of the things that I might be struggling with, she's struggling with too. So you're not alone. It's not about me. It's about this situation that we're all having to live and work in at the moment. And it is particularly challenging, I think. It feels very much that this wave is really hit us, and it's particularly challenging, not just because of the pressures, but also because it's raining outside, it's grey, it's January, you know, and I think it was just really nice. So I would encourage anyone that can manage it to just find a moment to ring up a best friend and have a little bit of a chat and a catch up.
That's a nice one. Are we getting any on the top tips? Are we getting any on the chat, Kelly, coming through yet? Or anything that's worth a say?
Just give me a moment to scroll down. We've got some popping in.
Thank you.
We've got someone who has trained in emotional freedom technique and said that it is brilliant.
Wow.
Another one, and I absolutely commend this. Amanda is telling us it's okay not to sit at my computer all day. Take a break, walk down the garden, cuddle the dog. Absolutely. Somebody else has built in some virtual coffee time daily, optional to join, but have found it to be very valuable. And I know that Grace and Holly, their colleagues in their teams, you do that, which I know you all really enjoy, just having that moment to catch up with each other. Take time out to talk about the challenges. Absolutely. That's what I was doing with my best friend on Sunday evening. And keep connected with what's important to you. So, you know, if your family, friends, nature, laughter, all of these things are things that we all find really important. And it's important, as you say, to keep connected. Lots coming in. We'll start posting them into the main box so that everyone can see them.
That's absolutely lovely. I'm going to share the ones that you wrote, Kelly, when you wrote this, if that's okay.
Yeah, absolutely.
Some of them you've already mentioned, actually, about taking a break. Sleeping isn't a luxury. Gosh, I have great problems sleeping, and I'm sure lots of people do. It feels like a luxury at the moment, trying to get to sleep. eating regularly, eating well and staying hydrated, really difficult if you're working the whole day in PPE or you're having to come in and out of PPE, because drinking is a real difficulty, isn't it, when you've got masks on and you're having to leave a clinical area, or you're sitting in front of your computer all the time, and having a bottle of water with you is, unless you sit down and take that bottle of water with you as you go, as you start, you forget, don't you really? Information overload is a massive problem. I struggle personally with this quite a lot. I find it if I've got too much on my mind and too many jobs to do, and I can't focus on the patient interactions as I would want to. Forgive yourself and be kind to yourself, and I love that, and take care of each other. Making room for our feelings. That's, I love the emotional, I'm trying to think what you called it a second ago. I'm definitely going to Google that to make sure I have a look at that. Keeping in touch, Kelly's already said, it's okay to stop working if you can. We're all working far too many hours and trying too hard at the moment to work so many hours. We're having to, I understand that, but if you possibly can take some time out and take a bit of holiday. I know it's difficult, again, lots of places have cancelled holiday, for example. Avoid unhealthy responses. The ones that were written in the article, in this article, with things like alcohol, overeating, those sort of things that we all know about, and getting support, which I talked about when you need. I'm going to go back to you, Kelly, because it sounded like there were some amazing things, and just see if there's anything else that's coming up, because these are really, really good tips, aren't they?
Yeah, really good tips. So we have, sorry, I'm just going to scroll. I was just catching up on some of the questions that have come in. Somebody else is learning something new. They've done a vegan course. I think that's good, because if you're learning something, you kind of immerse yourself in what it is, isn't it? And you start thinking about that, which allows you sometimes that moment to forget about others. Someone else has said something which is really important: access what's provided by your employers. And they've said they're amazed at the volume of things that are being provided, and that some staff don't access them at all or are unaware that they exist. Really important. One of the things I think Holly's posted in the chat box is a link to resources that we're aware of. We've done some filtering of some of the different resources that were put in place at the beginning, sort of back in April, May time, and we provide links to a lot of those that exist in some of the bigger employers, but also some of the organisations like Mind and stuff that sit outside, that will allow you, if you're not, if you're working in private independent practice or sole practitioner, you can get access to some of these too. There's lots of apps and things that have become available, so absolutely important, I think, to see what's there and make the best use of the things that are there for you.
Thank you, Kelly. It's taking that first step, isn't it, which, as healthcare professionals, whichever healthcare professional we are, we're not very good at taking that first step, because we like to cope. One of the big skills of healthcare professionals is we cope, and we just get on with things, but actually sometimes we just need to stop and seek support, so wherever's helpful. So thank you ever so much for those. That's really good. What I think we'll do is we'll write a little list of them that will come out with the follow-up email that we send out through Holly, because some of those are absolutely amazing. So that's really, really good. It's hard when you're focusing on the webinar to read the chat as well. It's really hard to keep up with it, so we will send those out to you. So going back from our tips for wellbeing, which are really important, is a scenario. So we thought we'd look at health, because this is a scenario that comes up quite a lot, and Grace gets this sort of question quite a lot. So this is just Jacinda. She's been diagnosed with depression and anxiety, and her GP's referred her for cognitive behavioural therapy, which is fantastic. And the GP is obviously keeping an eye on Jacinda. Her boss is actually, Jacinda's talked to her boss, which is fantastic. I think that is a really, really good advice, to talk to your boss in these situations. And we've already mentioned occupational health, but a really important part of the care that you have in organisations. So Jacinda's asking, does she need to do anything else? So I'm going to pass over to Grace, who is fielding lots of these sort of queries. So Grace, would you mind taking this query about Jacinda, if that's okay?
Yeah, no problem. So first I'll just start by outlining that registrants all have a professional responsibility to manage and maintain their fitness to practice, and that's outlined in Standard 6 that we're discussing today. So this also includes a responsibility to make decisions about whether you're fit to practice, and you also should be declaring any changes with your health or any issues that you might have with your health and character with us as well. So we've developed additional guidance on health and character to help with these sorts of queries, but in summary, we don't need information on a person's health or health condition unless it affects your fitness to practice, or if you're unsure that you'll be able to adapt or limit your scope of practice in response. So in practice, it's really rare that we'll actually get any queries about a person's health or character. We only need to know if there is a direct patient safety risk or risk to yourselves or colleagues. So with that in mind, so long as the condition is managed and it doesn't impact your ability to practice safely and effectively, then we wouldn't have any concerns. So I think in this specific example, she is showing quite a good understanding and insight into a condition. She's showing that it is effectively managed. She's being open with her manager, etc. And so this wouldn't raise any concerns for us, and we wouldn't necessarily say that she wanted to make a referral. I would, however, say that if you were concerned about your health and character in any way, then you can always contact us and then we can assess the situation. The fact that there is something wrong, if you have a condition or something, that won't necessarily mean that you can't practice. It might just mean that there needs to be you might need to adapt your practice in certain ways. And if you didn't feel comfortable with coming to us, you can always talk to your professional body, your union or your employer. They'd all be able to direct you and advise on this.
Brilliant. Thanks, Grace. That's fantastic. Yeah, that's perfect, isn't it? And you mentioned the guidance that we've got, so I'm just going to flash that up on the screen if that's all right. But we've got that guidance on health and character, haven't we, Grace? This is the one you were really talking about, wasn't it, really, where it's got some really clear guidance about what you need to do for your health declaration, the implications of making that declaration, some stuff about insight and understanding of what's happening to you, which we'll talk about in a minute again, and information generally that you need to give us about your health. I think that's really important. And this is particularly the bit that's in this bit of guidance that talks about when you should tell us. When you should tell us if something's happened, and it talks about point 9.5, and it talks about you must tell us as soon as possible if these three things happen. So if you accept a caution from the police, or you've been charged with or found guilty of a criminal offence, if another organisation responsible for regulating health and social care has taken action against you or a finding against you, or if you've got any restrictions placed on your practice, so if you've been suspended or dismissed by your employer because of concerns about your competence or conduct. And those are the important words, really, concerns about your competence and conduct. And we've got another, as well as having those three things, we've actually got a little diagram that sort of brings together all those things. But Grace already also talked about the additional support that you can ask, or who else is around for you to ask. And around the edge are exactly what Grace said: professional bodies, employers, your colleagues are always really useful, your line manager and your union. And if in doubt, we've got a phone number, but we've also got an email that you can send information to. So you've got to consider whether you need to make a self-referral. You've got to think about, has standard 9.5 been met? Have you done those things? Does it fall into any of those three categories? And then how to make a self-referral. You can make one online. So there's a step-by-step process, which I think is really clear. So we're going to plug up another little quiz. We're sort of looking at the two times when situations are managed in two different ways. And this is Sunita, and I'm going to just pause while you have a read of Sunita. Okay, so Sunita, she's been being very sensible, isn't she? She's had her epilepsy, but she hasn't had any seizures for the past 2 years. She's always tells her colleague, and I think this is a really important point, is telling your colleagues or telling somebody at work, if you're working with, if you're not working on your own, but if you're working with other people, it is important to tell your colleagues if you can. I think that's really, really useful. But Sunita's asking if she should sign the health declaration. I'm going to come back to Grace, if that's all right, Grace, and see what you think, Grace, if that's okay.
Yeah, so as I outlined before, individuals only need to refer to us or inform us of a condition if it will actually affect their ability to practice safely and effectively. So in this example, Sunita is displaying clear insight and understanding of their condition. She's clearly taking steps to manage it by taking responsibility for continuing treatment, updating her manager. So from our perspective, it means her epilepsy shouldn't affect her ability to practice, and she wouldn't need to make a self-referral. And also, so as part of your registration, when you make the health declaration, Sunita would be able to make that health declaration because her condition is managed.
Yeah, thank you ever so much, Grace. That's really, really clear. Now, we thought we'd show you another one because we thought, I'm going to leave Grace on the screen for a second, because we thought we'd show you one which is sort of similar but different, because it sort of defines really in what situations you might need to, or this one's slightly different. So we're going to go to Zahara. I'm going to pause for a second while you're reading that one. So it's slightly different. So this Zahara is slightly different, isn't it? And it's got some clear differences to the previous one, hasn't it, Grace? Previous scenario, because you know, it says there, doesn't she? Unfortunately, she's not taking the prescribed medication correctly, and she actually did have a seizure a couple of months ago, and in fact, he hasn't told her GP that either. What do you think of this situation, Grace?
Yeah, exactly. So this is a little bit distinct from the previous example, because in this instance, Zahara isn't effectively managing her condition. She's had a seizure quite recently. She isn't taking appropriate medication. So in this instance, they wouldn't be able to sign the health declaration. I just want to point out that it's not the health or condition that's the problem. It is the fact that they aren't managing it appropriately. So just to reiterate, if you do have a condition or something, that doesn't mean that you can't practice. It just needs to be managed appropriately so that you are safe to practice.
Yeah, I think that's a distinction, isn't it, Grace? That's exactly right. So brilliant. That's very reassuring as well. So it's about managing your health condition, isn't it, really? Okay. So what we wanted to do also was mention that we are actually today, yes, 2 days ago, we started a consultation because we're actually going to look at some changes to this guidance on health and character. So we will put in the chat bar, but we'll also put in the email that we send out to you. If you've got time, please, it is important, particularly if anybody's got health and character issues that they want to write about and want to contribute to this consultation because you've had experience of those issues, then it's really important to do so. So that will be open for a while, and it's open now. So do make sure that you contribute to that if you possibly can. And we're going to come to any questions. Kelly, questions that have come up particularly that we can help with, either Grace or myself?
So there's a couple of follow-up questions, I think, really, rather than new ones. The one about the stress risk assessment, we've been asked how frequently would you perform that, and I think probably in answer to that I would say that following the health and safety executive's guidance on that would be the most important thing. I haven't had time to have a look at that while we've been during this webinar, but I think that would be my starting point for seeing about how frequently you may need to do them. My understanding in terms of sort of managing risk and things is, when there's been some sort of significant change, I think that would be something that would trigger it. And then generally organisations tend to keep their risk assessments under constant review with an ability, through their sort of governance roles and procedures. So there should, I think, in most of the larger organisations be built in time for those reviews, as well as changes in circumstances that may alter the risk level, either improving it or making it a higher risk situation. So I don't think there's a stock answer of once every week or once every month. I think it very much depends on internal policies and procedures with your employers, as well as changes in circumstances. And then another follow-up question, just some clarification for us about the testing question, so about whether or not tests should be done. I think the question really was about whether you as practitioners should be being tested. I don't know, Grace or Kim, if you're able to help with that answer.
It's difficult at the moment because lateral flow tests have been rolled out to many health and social care practitioners, but I don't think they've been rolled out to private practitioners, which is quite difficult. So, and and it seems to be in different places they have been rolled out. So for example, if you're vaccinating, if you're a vaccinator, often at the beginning of your shift you'll be asked to do a lateral flow test. So I think it's all about employment issues, these are. So unfortunately it's a situation that you need to raise with your line manager. And I know for myself from working in a big trust that they're hoping they've put in an order for more lateral flow tests, for example, because often bank staff haven't got lateral flow tests. So I think the usefulness of an immediate COVID test is becoming more apparent, and that it's being rolled out even more. And Grace, is there anything more you want to add about that?
No, I think you covered it well. I think it would be down to employer policy and what you felt comfortable with, and yeah, if you had any concerns, I'd speak to manager, employer, and understand what's required of you in that sense.
Yeah, the great thing about these questions is they will also feed into the fact that if you are concerned about them, we will develop a little answer for you on our website. So they also feed into our HCPC COVID hub. So we'll make sure that some of these things that people are raising turn into frequently asked questions, and we can pop links up that are really useful to you. So that's actually fantastic.
Yep, I think that's right. We've got some frequently asked questions that Grace and her team are on top of all of the time, yes, and are always being updated. So have a look in our COVID hub, and we'll try and feed some of these things in through that too. And for the employer one, so the information there about sort of the stress risk assessments and things, we also provide FAQs and stuff for employers, and we have an employer hub and guidance and stuff that we issue for employers, and so we will have a look through that and see whether there's something we can do there to help ensure that raise awareness really of those requirements for employers.
Yeah, definitely. Thank you very much. Okay, so a few other resources to point out to you. We are currently doing a diversity data survey. We are, as you know, committed to being an inclusive and diverse regulator, and we want to make sure that all our services are accessible to you as registrants and free from discrimination. So we've actually sent you an email with a unique survey ID number. We know that time's busy at the moment, but we would be super grateful if you could reply to that. You will get a follow-up email in the next few weeks just reminding you, and if you haven't had an email, then if you want to just email the EDI team, they will send one out to you. It's just really useful. We need to know about you to make sure that we can then look at our data and find out what's going on for you using the diversity data that we hold. So it's really important. Just a reminder that there is a collage of fantastic COVID stories that if you want to read about, if anybody wants to send one in, we can talk to you about that. And we've also got our COVID hub that we keep sort of flagging up, but it is really useful, and it's sort of like a combination of everything in one place that you might find really helpful. We mentioned this last time, our student hub has only just been launched. It was launched about 3 weeks ago. We're getting some really good footfall through it from our students. So that's a really another point, and it will also host some of these webinars, any other webinars that we actually have done. So we're coming to the end of our webinar fairly soon, but we've covered quite a lot about Standard 6. I'm hoping that we've responded to some of your questions. We've looked at minimising risk and managing your own health, and those two really important parts of, I think, our standards and guidance. I'm going to take a little bit of time to look at our Slido app, so I'm going to ask you a couple more questions if you can bear with me. I'm going to ask you this question again that I know I whipped off the screen too quickly last time. You're quite right. What word comes to mind when you think of the HCPC now? We compare these to the ones you said at the beginning. And we've got quite a lot of data from you already from our previous webinars. So they are quite helpful to us because we can see whether these webinars actually change or your thoughts are the same about us. You know, it gives us a really good feel, and somebody's put management there. Let's see if anybody else puts anything. We definitely are a regulator, so thank you for that. But yeah, it's really helpful. It just gives us a real good idea of the support that we can provide you and what we need to do to help you, because we spend a time thinking about these webinars, and your time is so precious at the moment that you dialing in for an hour of your time, we recognise we need to meet your needs, and we need to make sure that these are useful to you and valuable to you. And you're right, we do spend a lot of time writing standards and guidance. Informative, brilliant, that's good. I like that one. And CPD is another one which is useful as well. I'm going to pause. for a second, but I think that's quite good. Okay, so I'm going to come on to my next one, if that's okay. How would you now rate your understanding of Standard 5? Oh, we've got the questions there. I don't know why they've come up. We will look at those questions in a bit. How would you rate your knowledge? Actually, I'm going to come back to that one. Sorry, I've put the wrong one up. After this session, how would you rate your understanding of Standard 6, it should say, of Standard Conduct, Performance and Ethics? Sorry, I put the wrong question up there. And again, this gives us a bit of a reason for carrying these on, because if your knowledge has improved, then it will make us feel like they're helpful to you. I'm hoping there are lots of students here today, which I think is really useful, because I know that your standards and guidance that we write, you'll be using in your essays to underpin lots of work that you write about. So hopefully these will be useful to you as well. So thank you ever so much for that. And a couple more questions. How likely are you to recommend this training to your colleagues? Is a very simple one, just a quick click, whether you do or you don't. Sometimes I think when I write these evaluation questions, sometimes it's good writing yes or no, but otherwise it's quite nice to have a little scoring system, isn't it? And I have to say, you may not be able to see, but I can see that lots and lots of you are responding to this one. Sometimes there's a bit of a delay in the number that you can see at the top, but I can see that lots of you, and I've captured all those things for you. And my last two are, has this session helped you to reflect on your practice? We know that actually the most important thing for us is that you go away from this and you think, gosh, that was a really useful point. I didn't actually know that, or I didn't know the HCPC were lobbying, for example, I didn't know the HCPC were lobbying government about the distribution of vaccines to health and social care professionals who are our registrants. So I think those things are really, really helpful. And my last question to you, so thank you for that. Has your knowledge of the HCPC improved? Yes, no, or it was already good? That's a very quick one. It doesn't take a second to reply to that one, does it? And we honestly value your comments and thoughts. It enables us to help you and do what we can. I can see that on my screen that lots of you have responded to that one, so I've captured quite a lot of responses to that, even though you may see a few less on your screen. So thank you very much for that. I wanted to remind everybody of a save the date for Thursday the 11th of February. We will send out a save the date for you at 2 p.m. looking at Standard 7, looking very much at reporting concerns about safety. We will be continuing the discussion about reporting concerns and some of the ways that you can actually do that. And we have already said that please do get in touch with us. We're only too happy to answer. Grace and the team are there answering queries and answering your questions and concerns. And I wanted to take this time quickly to thank Grace, Holly, Kelly for contributing to this webinar. That's really super useful. But do engage with your regulator. That's what, again, we are there for. And a final big thank you to everything you're doing. It's not getting easier yet, but we're hoping it will do. But, you know, patience, everybody is recognising the great good that you're doing at the moment in the really difficult roles, whatever they are, because we're lucky at the HCPC, we regulate so many different professional groups, and so many of you are doing so many different things in the current fight against the pandemic. But thank you very much. I'm not going to go to Kelly for any more questions because we are exactly at time. I'm going to reassure you that we will take your frequently answered questions. If we haven't answered any, we will put them in a summary for you. If there's any big ones, we'll put them in the follow-up email to this webinar. And we will also, if you want to email us, I'm going to go back to that slide. If you want to email us at professional liaison, that's mine and Kelly's email. If you don't feel that we answered your question, then do email us at professional liaison at the HCPC. Take a picture of that screen. We will send it out in the follow-up email for you to ask any question that you don't feel we've answered, because we want to do justice to all of them. So thank you very much for your time and energy, and take care. Thank you. Bye-bye.